Prime Minister and his team and the other members of the political directorate here in the parish of St. James, and on behalf of the health staff. We're at Type 5 Comprehensive Clinic, Prime Minister is touring. A lot is going to be happening here. It is the most important health center. And a lot of talk about Cornwall, a lot is going on there, but I just wanted the Prime Minister to see Type 5, what we do. Over 67,000 persons were served here last year. And there are plans for expansion coming over on this facility, which I briefed him on. As well as over nearly 400 million have spent over the last 5 years on health centres across the parish of St. James. So Prime Minister, I just want you to know that we're doing the work and people are getting served. And Mr. Wallace here, who is head of primary care in the parish, can elaborate more on that. But I hand over to you.
Thank you, Minister.
Push them there.
When I move about the country, one of the complaints that I quite often get is about access and service in healthcare. Clearly, more Jamaicans now are exhibiting health-seeking behavior than previously, meaning that Jamaicans are more cognizant of their health condition. Certainly the work of Minister Tufton with Know Your Numbers and getting fit and staying fit, that would have helped to increase our health awareness, and so we are seeking out healthcare more than before. But the problem is, when you come to the actual health facilities, you may meet upon congestion. A lot of people are there. You may also get frustrated because that congestion reduces the level of individual care that everyone expects to get. And so these are general complaints, and then we have complaints about facilities themselves, meaning the equipment and the infrastructure that is there, and we have complaints about waiting time and just general access to medicine. So there are many challenges in the health sector, and we acknowledge those. But I think the conversation should also acknowledge that great effort and not just good intentions, but significant resources have been spent. But this is not just spending widely, this is spending strategically. So I urge Jamaicans to, for a moment, step back and reflect on where we are. The main health facility in this region, in the parish of St. James and surrounding parishes, would be the Cornwall Regional Hospital. That was built over 50 years ago. Since it was built, it has not undergone a program of consistent maintenance to extend the useful life of the building. So the building actually reached the end of its useful life over time, actually. We, as an administration, took a decision that we would make a massive investment, the equivalent of literally rebuilding the building. That's the level of investment that we have put in place. Now, that investment, right during COVID, would have disrupted healthcare in the region, no question. The minister, I think, did an amazing job in ensuring that there were interim facilities, transitioning facilities, and those facilities were built on the compound of the Cornwall Regional Hospital. We are in the final phase of the development. I toured it last year, and from what I'm seeing, that the building has been restored to better than its original condition. And there will be more modern services offered with more modern facilities. No question, it will be a credit to our health system, and certainly for the people in and around this region, they will benefit. But right beside it is a brand new facility, the Adolescent Children Hospital, which I'm certain will become a regional hospital. It will have advanced specialists and advanced care. So the people of this region, indeed the entire Jamaica, will benefit significantly from this, and a great addition to our healthcare. But the focus has been on Cornwall Regional Hospital. But Jamaica's healthcare and our very good ranking in terms of health generally is as a result of our primary health facilities. We have many clinics all around. In every corner of Jamaica there is a primary health care facility. We are standing next door is a type 5 clinic. A type 5 clinic is virtually a hospital. It's just one grade below a hospital. And it serves, Minister would say, 67,000 visits last year. That's a huge service pool. And this facility will be expanded. Where we are standing now is an adjacent property to the Type 5 health clinic. Minister Tufton has just announced that we will be acquiring this property and we will be expanding that Type 5 health facility. So what it means is that the capacity for early intervention in health crises will be expanded in our primary care. So I want to say to the people of this region, this is the northeastern region, to the people, not western region, forgive me, that the government is cognizant of the issues we all face in health. We hear your cries daily, and we are moving as quickly as possible to improve our ability to serve you. Remember, these challenges weren't created overnight. From I've been in politics, it has always been the complaint. From I've been serving the people of the country, it has always been the complaint. What has changed is that for the first time, governments can make not just short-term allocation, but we can make massive long-term budget commitments to health. That process will take some time before you actually feel it in the service you receive. But once it is done, we would have moved our healthcare from one level to another. When the Cornwall Regional Hospital comes on stream, the quality of healthcare is going to be moved to another level. When this is expanded, the quality of healthcare will move to another level. I'm here to tell you that later on this month, we will be breaking ground for a massive upgrade, refurbishing and construction of new buildings at the Spanish Town Hospital where I was born. It will be a massive investment in healthcare. We're going to be building 2 new Type 5 health facilities, one in Portmore and one in Olab, and these will be modern facilities. So yes, there are challenges in healthcare, many challenges, but these challenges did not just emerge overnight. They didn't emerge because, you know, doctors don't care, or ministers don't care, or nurses don't care. They emerged because our economy simply did not generate the revenues to support the long-term allocations to increase and improve the service capabilities of our health center. Now, we have, I'm not going to here say we have fixed the economy. We are fixing the economy. It's a process. We are in a better position now, and that should be taken for granted. But having fixed the economy, having put it on a better track, we are now taking the dividends of that, the proceeds of that, and we are allocating it to the areas that matter to the people, your healthcare. So my tour today is just to shine a spotlight on not just the Cornwall Regional Hospital, but the investments that we are making in our primary health care as well, and to give all Jamaicans the assurance that your health care is our primary concern, and we are doing what is necessary to improve access and quality. God bless you and thank you.
Yeah, we also have a stop at the Montego Bay bypass road.
Remind upon him.